All right. Well, welcome everyone to this edition of Parent to Parent. I'm Rashi Batts. Here I am. We just finished the 6 p.m. broadcast, so we are getting off the set literally right now. So it's a little loud behind me. Normally we do it during this time, so you guys, if you're regulars, you know about that. So we're talking about something that affects me personally all of a sudden, Strep A. I'm not sure if Strep A is what my son has, 6 years old. He'll turn six next month, but he did test positive for strep. So my husband texted me because he took him to urgent care. He had a sore throat. And then I also had scheduled to talk about this because there's this huge surge in severe Strep A infections, and it's prompted a lot of health warnings as well. So what exactly do we need to know? So I have with me someone that has all of those answers, Dr. Anthony Flores. So I'm going to bring him in right here. He's the chief of pediatric infectious diseases, UT Health Houston and Children's Memorial Hermann Hospital. So thank you for coming here this evening and joining us for this very important and concerning topic.
Thanks for having me.
Yeah. So what are you seeing right now when it comes to Strep A?
Yeah, so Strep A, as you indicated with your own child, that the most common thing that it causes is a sore throat. So strep pharyngitis, we call it. It's by far the most common infection with this bug, and it's easily treated. That's the good part.
Mhm.
So the fever, sore throat, those types of things. But what we've seen recently here in the past couple of months is we've seen this kind of surge in what we call more severe cases. And so in addition to sore throats, it can cause skin infections. And every once in a while, either through the throat or through the skin itself, it can get into the deeper tissues even into our bloodstream and bones and things like that. It doesn't happen often, but it happens enough that we see it in the hospital quite a bit. And so in the past couple of months, we've seen this surge of cases, and it's even a little more prominent because during the pandemic, we hadn't seen much at all. In fact, invasive strep infections, what we call these severe infections, it actually decreased considerably compared to pre-pandemic. And we think that's because of the masking and social distancing and other things that we did to prevent COVID. And so now that that's been kind of relaxed, I think we're seeing this surge in them now that it's everybody's really interested and appropriately concerned to see where this is going to go. Are we seeing a peak here? Is this going to continue to go up? And how long is this going to last?
So when it comes to strep, it is contagious. So what are you supposed to do as a parent if your child does have strep?
Yeah. So the first thing, if you suspect it, and again, the most common thing is a sore throat. So if you have sore throat, fever, this is usually in kids that are kind of school age, so 5 years and older, is where it's far the most common. If you have a suspicion, absolutely take them to the pediatrician, take them to urgent care, take them to be evaluated, and they can do these rapid tests to look for the bug itself. And if that's positive, again, antibiotics are readily available to treat it. And once treated, even initiating treatment, usually symptoms start to get much better within a day or two.
And what about say you have other kids in the house? Our immune systems are probably a lot stronger than theirs. So what should you do?
Yeah, so anybody can get exposed to this in childcare settings or in schools. Obviously, kids are in close proximity to each other, and this is spread through what we call large droplets. Unlike COVID, which was airborne, and with those particles would stay in the air for a long period of time, and we had to wear special masks to try to prevent the spread of it. Group A strep is larger droplets that don't stay in the air as long, but so it can be, in close proximity to somebody. So people that live in the same household, in the same classrooms, those types of things for longer periods of time, they're more likely to transmit it to each other. So that's why we get these warnings. If you've got a child in any kind of school setting or daycare setting, they send you these warnings that a case of Group A strep has been identified in the to give you that warning that if your child starts to come down with symptoms, that they've been exposed to it, so to take them to be evaluated more readily.
So is it best to keep the other kids away or even mask yourself?
Yeah, so clearly masks were incredibly effective at reducing the spread of group A strep. Is it reasonable for everybody to mask, just to prevent group A strep? I think that's probably a little bit excessive. But the best things that you can do, well, I will say, that usually within the first day of treatment, the amount of bacteria in the throat, at least for sore throat, goes down so rapidly that the transmission goes down. And that's why those guidelines tell us that after 24 hours of treatment, we can return to school, we can return to work, those types of things. If, to washing hands, so this can be spread by touch as well. So those droplets settle on surfaces, and if we touch those, and then we touch our, kids are always touching things and touching their face, and we do too. And so if washing hands, good hand hygiene, those types of things will prevent spread.
One of the things, I mean, we've talked about this like triple demic. So we have RSV, COVID, and the flu, and now we're talking about Strep A. What do you kind of foresee? Like, as a parent, I'm thinking, okay, what's the next thing? What's the next thing to look out for? And I'm sure you get that question a lot.
Yeah, I think it's important to understand that, while we're seeing this surge in cases, and that's something that we as professionals are watching very closely, I think it's important to understand that these are still relatively rare. They're not common things like flu is much more common, RSV is much more common, COVID is still much more common than group A strep. These severe group A strep infections are. So even if you didn't recognize it early, and you say treatment was delayed, the chances that you would get one of these severe infections is still pretty low. And so I think that's important to emphasize, that this isn't, it's not like we're going to see these surges in group A strep like we see with flu, like we see with COVID, and those types of things. And so exactly what this is going to do over time, are we going to still see these increased cases moving forward? I think that's something that we're all staying very alert to.
Yeah, definitely. And then what's interesting is how, these viruses are causing other things, like you were saying, skin infections. Is that new, or is that, seeing that surge, is it caused by the fact that we were masking for so long?
So I just want to understand your question correctly here. So, in terms of the viruses that we've seen, so those are primarily the respiratory infections that we see with the RSV, flu, COVID, and I'm just getting over one of those myself, and so that those have been that we've kind of reduced the rates at which we're masking now, when we're more social interaction. We've seen all of those things come up now. And it's not surprising. So that we're seeing other things like group A strep do this, I think it makes sense. And I think we can explain it by the reduced masking that we have. And that's why I think the current recommendations are, given our COVID levels here in Houston, which I think have peaked right now. But I think the recommendation is, if you're in crowded places, you should mask. It makes sense, to prevent the spread and to prevent infection.
Okay. One of our viewers here is asking why RSV is causing UTIs in adults. Have you heard of that?
Yeah. So it's when we get a respiratory infection like this, it can do other things to our body. Through dehydration and things like that, it can alter other parts of our system, and so that it can lead to other types of problems. And so I haven't, I'm full disclosure, I'm a pediatrician, and so we see the mechanism by which we see urinary tract infections in kids from viral infections is a little bit different than what they see in adults. But we do see some complications like that, and so one of the things that we worry about, again, not just UTIs after RSV, but any respiratory viral infection can predispose you to bacterial infection in your lungs. There's damage that's done by the viruses to our airway lining, and that prevents or provides an entry point for all types of different bacteria to get in there and cause a problem. Again, not common, but something we do see. And
what do you feel like when it comes to I know during COVID, parents were not as hesitant to take their kids out of school because, COVID. But now sometimes you may see children coming to school with a fever, or, I, as a parent, and my friends that are parents see that as well, just because the culture has kind of changed. I think, like we were talking about also in the workplace, it's like if you called in sick during COVID, it was different. But now it's like, okay, we're out of COVID, so, so to speak, and thinking that it's not, you're more hesitant to call in. But when we're talking about the kids, do you see more parents hesitant to take their kids out of school?
Yeah, anytime we have to take our kids out of school, I've got two kids myself, 5 and 7 years old, and anytime we have to take them out of school, that's a burden on the parents, right? And so it's something that we have to be able to manage, and so I think that there's always a subset that are going to say, I can't afford to miss work, or I can't afford to manage that, and so I'm going to send them anyway. I think the safest thing to do, and what most guidelines for either childcare settings or schools are, is if your child has a fever, they should stay home. And I think that whether they have COVID, the flu, whatever it is, they should stay home until they're fever free. I, as a parent, I try to practice that. We have the luxury of having two of us that are able to to manage that. But that's ideally, if your child is having fever, you keep them out of school, you keep them out of those settings until they're feeling better. And usually by the time that they're feeling better, that fever is resolved, that their chances of being contagious are far, far less.
Yeah. And I just want to address this. Shelika Smith says COVID is not over. I wasn't trying to say COVID is over. I'm just saying that there is a perception for some people who may feel that way, and that I've also spoken with, I'm forgetting, Dr. Ostrowski. I don't know if you, yeah. So he was also talking about just how it's kind of unfortunate how some, maybe even employers, feel that, it's a negative when you're calling in sick, when you're really sick, and they're, kind of making you feel guilty. Now, I have to admit, I do feel guilty because my son yesterday, I thought he just didn't want to go to school, and he was like, I'm not feeling too good. So, you're kind of like at that thing, like, okay, are you not feeling good, or do you just not want to go to school? So parents, we all do that. We're trying to do the test. Like, what is the truth here? So, and you with the 5 and 7 year old, I'm sure you've gone through that too.
Yeah, no, and we as working adults, I think we tend to work right through a lot of things that we probably shouldn't. And I think, from my own perspective, I think it's at least in my profession, I think it's in some ways made it a little more acceptable to say, look, I have fever, I'm not feeling well, I'm not going to come in, and I can work from home. If that's possible, we do that. And I think that's at least in my work setting, that's been promoted. And as a leader of a division, that's something that I promote to my faculty. I say, look, if you're not feeling well, let us know. I mean, I think everybody's good about that. But I understand that not all employers are like that. Many, there's an unwritten expectation, that you're going to come in no matter what. And so that's, that was before COVID, and I think we did that a lot more before COVID. I would like to think that during the pandemic, and now as we transition to whatever stage this is, and I agree, COVID is not over, but we're certainly transitioning to another stage of it. That I would hope that we would start as a society to start to put a little more emphasis on wellness and how we can better manage that, not just with COVID, but with other things.
Yes, definitely. I think it's more of a cultural thing too, with, you get like a pat on the back if, well, this so-and-so had a fever and they still work through it. And it's kind of like, great.
Yeah, but it was a badge of honor before, and now,
now
it's like, well, you've infected people.
Right. Like, that's not a good idea. But let me tell you, like, whenever I have a sore throat, but I'm feeling fine, like my voice is bad, I get so much sympathy just because of my job. They're like, oh, you can't go on it. Are you okay? I'm like, I feel fine, guys. My voice is just gone. Yeah. Well, is there anything else you would like to tell parents when it comes to just trying to keep their kid safe and healthy at school?
Yeah, again, putting it in the context of this, kind of surge in Group A strep infections,
Mhm.
I think that being vigilant, we're all through the pandemic, it seems like everybody's been checking temperatures and checking symptoms almost on a daily basis, and it gets tiring. I get it. But I think to stay vigilant, and if you're concerned about something, reach out to your pediatrician, reach out to your physician, and ask questions. That's what we're here for. That's our job. That's why we do what we do. I would rather evaluate a patient and tell them that everything's okay than have them worry at home and then have in potentially have something bad happen. The I think that would be my that maintaining vigilance in uh, even though this last 3 years has been very tiring for us, um,
Mhm.
maintaining that vigilance, not just with COVID, but with any illness, I think is really important.
Yeah. I also want to say thank you for, acknowledging that part about just you as a parent. Like, it's been tiring, and it's like that for everyone. I know you come across, obviously you're a doctor, so it's like, okay, the doctor thing, but you're also getting affected by it personally. So that really, offers a great perspective there. I was going to ask you one last question. You
Sure.
know, pediatricians, they're inundated with obviously so many kids because of everything that's going on. Do you recommend a parent wait until they get the appointment, or would you say it might be a better idea to go to urgent care?
So this really depends on the symptoms. So if it's I'm gonna say just a sore throat. I
Hmm.
realize a sore throat in a 6-year-old can be incredibly challenging.
Right.
But the things that would be more concerning to me, that I would say you need to see a medical provider sooner than later, would be if certainly if this pain is out of proportion and it can't be fixed, with just some over the counter, ibuprofen or Tylenol. If there's fever that doesn't come down with those, if sometimes these cause skin infections, if those skin infections, if it's causing a lot of pain, if they're really tired, really sleepy, and you can't, when they shouldn't be, those are kind of concerning signs. I would say those individuals need to be seen sooner than later. Otherwise, I think waiting that day to see the pediatrician, I think is perfectly appropriate.
Yeah. I mean, I feel for the parents and the pediatricians and the nurses. I know everyone's just overwhelmed
Yeah.
and just trying to do the best they can on both sides. Well, thank you so much, Dr. Flores, for your perspective and all this great information. I really appreciate it.
But thanks for having me.
Yeah, definitely. Well, thank you all for joining us on this edition of Parent to Parent. I'm sure, hopefully, we'll talk to Dr. Flores soon, just about other things that are going around, because I know we're always concerned about our kiddos and being happy and healthy. So until next time, I will see you then.